Okay, yeah.
See if I can turn it off.
Good afternoon, everyone. My name is Alicia Bank. I work for the Division of Pay and Benefits. Thank you for joining us. On behalf of our director, Tasha Brown, we welcome you to this afternoon's presentation on Social Security in Retirement, which is being delivered by Stephanie Todd from the Agency of Social Security Administration. Before we get started, I have a few comments. We have a survey, and we ask that you please complete the survey at the end of the presentation. There are a couple of ways in which we will deliver the survey to you. If you registered through the CMS LMS, you will receive an email with a survey link. Anyone that is signed in today, please see the HR specialist who is at the desk right outside this auditorium. If you are in-person attendance, you may also drop the survey to the HR specialist outside. For questions, all questions will be addressed at the end of the presentation or when the presenter instructs. If you are in the audience, please use the microphone in the middle of the room, which is right there, when you ask your question, and please allow everyone to hear the question and allow them to answer the question so everyone can benefit from it. For those of you on the phone, please mute your phones temporarily. Our phone moderator will unmute the phones and will let you know when we are ready to take your questions. And now I will share with you a little bit about our presenter. Stephanie Todd started her career with Social Security Administration in 2010 as a claims specialist in Geneva, New York. Stephanie is currently a claims specialist at the Glen Burnie District Office and has been there since 2013. Stephanie also completed a temporary assignment as an operations supervisor in the Baltimore Wabash District Office in 2014. Now, ladies and gentlemen, please join me in welcoming Stephanie Todd.
Hi, everybody. Thanks for having me. So thank you very much for the introduction. I am going to go through a slide presentation with you to give you some basic information. And I know from my experience giving these presentations that the most valuable part is the question and answer after. So we will get there and definitely jot down questions so that way I can answer them for you. So the presentation is just to give you a good overview of Social Security, what type of benefits there are, some basic rules, and some data points, just so you can get a little bit acquainted with who we are, what we do, and what you do, and how it contributes to what happens later, retirement, and all that stuff, okay? So the new thing is being with you through life's journey, and all the different points at which during your life you contact Social Security or make some Social Security milestones. So that's kind of how they have the presentation broken up. So without further ado, we'll just move it along here. So the first time that a lot of people encounter Social Security or FICA taxes and things like that is when you start working, because then those taxes start coming out and you notice, and you start making more money and you notice more taxes are coming out and all that. So that's, I remember that being quite a transition in my young working life. So I mentioned FICA already. It is a US federal payroll tax deducted from each paycheck. It stands for Federal Insurance Contributions Act. So later as we unravel Social Security a little bit more, you'll see how that title really does make more sense. The total that's deducted is 7.65, which has not changed since the last year, possibly a little bit more. So 7.65% is the FICA that's deducted from your paycheck, and then your employer matches that to get a total of 15.3. Your FICA contributions help fund what I call the trust funds. That's not just what I call them, that's what they are. But the trust funds are for retirement, disability, survivors, and all the different beneficiaries that receive benefits from the trust funds. They're funded through FICA, okay? So did you know about 174 million workers pay Social Security taxes in 2018? Now, by the way, we're going to be making some corrections to some of the figures in here as we go through. So we have to follow this rule called 508 compliance, and we don't have the figures from 19 in the presentation, so I'm going to make sure you're paying attention so you can update them, okay? So about 94% of all federal workers are covered under Social Security. So what about the other 6%? Maybe some of you are in that 6%, which are civil service retirees. Is anybody civil service retiree in the room? Okay, so civil service retirees are different from us folks in FERS. FERS is the new retirement system after 83. So we pay, us FERS people, we pay FICA taxes. The civil service folks, taxation was a little bit different because you have your pensions. So that 6% is made up of the civil service retirees, non-tax pensions, other pension systems, like for instance, Texas has a teacher's pension that they pay into, Florida does, Massachusetts police officers. I've met a variety of people throughout my career so far in a variety of situations there, but their pension system causes them to be treated a little differently, and we will talk about that. The buzzwords there are WEP, W-E-P, and GPO, so we'll unpack those in a minute. So of the Social Security beneficiaries of what's being paid out, Social Security is paying out about $58.8 million. $5.5 million goes to SSI. Now SSI we're not going to touch on too much here. SSI stands for Supplemental Security Income, and SSI is a needs-based program. So we take into account someone's living arrangements, their income, and their resources. So SSI is based off of the old federal welfare program. So in Maryland, some of you may know, based on your career experience, that when someone's eligible for SSI, they're eligible for medical assistance. So you can tell kind of based on that what type of requirements are what we're talking about for folks who are in contact with SSI. And there are some people who receive a little bit of SSI and a little bit of Social Security blended benefits, okay? SSI, the way that you qualify is you have to be either over the age of 65, blind, or disabled. So SSI claimants range anywhere from newborn babies who perhaps have been born low birth weight or with other medical conditions, all the way up to folks over the age of 65 who perhaps maybe never worked or only worked just a little, and we supplement SSI, Supplemental Security Income, to help them get to a threshold where it's a little more stable. So who pays for Social Security? You do. Thank you. We all do. So I think that's an important thing to know. It's an entitlement program. You paid in, you're entitled to it, okay? It's really important, therefore, that I make sure that anybody who comes into contact with me as a customer knows what you're getting and why you're getting it and how much and all that stuff. So I'm really big into the education perspective of it because that's what I do every day at the field office. I educate consumers about the type of benefits that they're getting, how much, why, when, better decisions, good decisions, maybe not good decisions, and all that. So we're there for your wedding. So has anybody been through the name change process? Yeah? Okay, cool. So when you change your name, you go through and update it on your Social Security record, and then forevermore, that's what it is. And then there's other reasons to change it. If you need a new Social Security card, maybe some of you don't know this, but Social Security cards, if you have a Maryland state ID that is unexpired, if you are over the age of 18, and you are a born US citizen, and you're not making any changes to your Social Security record, you probably can go online and get a replacement Social Security card. There are other states that are participating in that. I can't name them, but all I know is that Maryland was in the second group of states, and that's really exciting. So if ever you find yourself in the position that you just need a Social Security card and you meet that set of requirements, there's some others, but that set of requirements, you can probably just hop online and do that, okay? Does that sound good? Does anybody know who might be helped by that? Share with your friends, but make sure they go to a .gov website, okay? There's a lot of junk out there. Did you know, a lot of did you knows, as of December 2017, 3.1 dependents of retired workers were receiving $2.2 billion in Social Security benefits. At the same time, 1.7 million dependents of disabled workers were receiving $620 million in monthly Social Security benefits. So who are these people we're talking about? Well, for folks that are retired, we're talking about spouses, maybe that didn't work or worked very little. And otherwise, we're talking about children who are under the age of 18, children that are found disabled prior to the age of 22, who are referred to as Social Security, for Social Security purposes, as childhood disability benefits. So again, that requirement is over the age of 18, found disabled prior to the age of 22, unmarried, and never earned something called SGA, substantial gainful activity. So if anybody that you know has a child who is like maybe disabled since birth or has some developmental disabilities, if they've never worked on their own, they can pull benefits as dependents from their parents when their parents are deceased, disabled, or retired. So that's another little bit of who else gets Social Security. Spousal benefits is something I get a ton of questions about whenever I give seminars. The benefit for spouses, everybody says, I hear it's 50%, it's 50%. The 50%, the key word you want to write kind of next to that is benefit of 50% of the workers, unreduced benefit. The other word for an unreduced benefit is called a PIA, primary insurance amount. Okay, we'll touch on that again later. Spouses' benefits are also subject to reduction for early retirement. So if you are in a situation where you're going to be entitled as a spouse, if you're younger than your full retirement age, reduction applies. We'll see a little bit more about that later. If the spouse's own benefit is less than 50% of the workers, the benefits are combined. So again, we'll unpack that a little bit later, but just kind of keep that slide in the back of your mind. This is very important. So star, circle, draw a smiley face. This payment, if you receive benefits as a spouse, whether you like it or not, it does not hurt the worker. So if you're receiving benefits as a spouse or divorced spouse, it doesn't hurt the person that they come from. It doesn't reduce it, it doesn't take it away, it doesn't stop it, and some people go, oh darn, I really wanted to stick it to them, and some people go, oh, phew, we don't have to worry about that. So however you feel about it, that's the way it is, okay? Benefits of 100% regardless of age if spouse is caring for a child under the age of 16 or disabled. So this is one of those categories of people who receive receive benefits as a spouse. So for instance, if they're a couple that's husband's receiving Social Security benefits, mom is taking care of a developmentally disabled child or a child who's disabled or under the age of 16. Then mom can receive benefits as a caretaker. It's called Mother with Child and Care benefits. So they are unreduced from age. It's not an age-reduced category. And if that confuses you, it'll be okay because we'll get to that a little bit in a second. Let me just make sure I didn't miss any good notes that I wrote myself. The next one is a good one. Benefits for divorced spouses. You may receive benefits on your ex-spouse's record even if he or she has remarried. So this is about you. If you are a divorced spouse and you have not remarried, you have to have been married for 10 years, which is the little bullet point at the bottom that I think it deserves its own bullet point because it's really important. Duration of marriage counts. And so you have to be unmarried. You have to be age 62 or older. Your ex-spouse is entitled to Social Security, retirement, or disability benefits, and the benefit you are entitled to receive based on your own work is less than the benefit you would receive based on your ex-spouse's work. That's a situation that has to do with a concept called deeming, which we'll get to in a couple of slides. So we're going to take all these pieces and tie them together, I promise, okay? So, but 10 years is the duration of marriage requirement. I actually just took an application this morning before I left for someone who's considered to be something called an independently entitled divorced spouse. Phew, that's a title, right? So the independently entitled divorced spouse's rules, and in my brain I have this list of check boxes. They have to have been married longer than 10 years. They have to have been divorced more than 2 years from the current date. So she got divorced back in the 90s. She was married in the 70s, divorced in the 90s, so she's been divorced more than 2 years. She did not remarry. She has to be over age 62, which she was. She was actually 68. Her spouse has to be over the age of 62, which he was. He actually had just turned 66 like a couple months ago. So she was, and she never did a whole lot of work herself. She was, I guess, just a stay-at-home mom type thing. And so she filed because she was able to get the independently entitled divorced spouses. So the questions that we ask you when we interview you, we're not just trying to pry, we're actually trying to dig up points of entitlement for you, okay? Deemed filing. This is an important thing to talk about with regard to a set of rules called the Bipartisan Budget Act of 2015. This is something that had a major, major impact on how we do our jobs at Social Security. Some of the buzzwords that came along with that are deemed filing. Anybody heard of file and suspend? No? It's weeding its way out. Phew. If you become eligible for Social Security benefits, both as a retiree and a spouse, or divorced spouse, and you want to go ahead and claim your benefits, you must file for both benefits. And this applies to people who turn age 62 after January of 2016. So that January date is really, really, really important because people born before, that have their birthdays before that critical 62 birthday, they can ignore deemed filing. There's 2 exceptions to deemed filing, as it said. I'm going to be honest with you, I had to go look it up because they are very narrow points of entitlement. So the 2 exceptions, if you're interested in the trivia points for that, is number 1, if you receive spouse's benefits and are also entitled to disability. So if someone is entitled to disability benefits and they become entitled, let's say their spouse retires, dies, or is disabled, then if they're getting disability, if the origin point of their benefits is disability, they don't have to use the deemed filing requirement. They're already getting benefits on their own. So the deemed filing issue is to force people to file on their own Social Security record so they can't any further sort of super duper maximize the benefits later. So if you file on one, you're deemed to file that same application on your own. The other exception is that child and care benefits for children under 16 or who are disabled. As I mentioned, that mother or father with child and care benefits, that's the other exception to deemed filing. They can continue to receive benefits as mother of child and care spouse without the requirement of having to go back to their record when they become eligible, so when they turn 62. Does that make a little bit of sense? Somewhat? Okay. If we're getting there, that's good. I'm happy with that. So what is important to know is if you are getting to age 62 after January 1st of 2016, which I'm thinking I'm probably talking to a lot of you who are in this category. Maybe some of you aren't. But if that's the case, it used to be that you could exclude part of the application, and we're going to get to that bit when we dig into the retirement stuff, and then we'll work backwards on that. All right, voluntary suspension. Now, I mentioned the buzzword file and suspend. When Bipartisan Budget Act was coming down the pike, there are lots of people who were running into our office and going, file and suspend, file and suspend. I don't think they knew what they were talking about. And the reason was because they took away the file and suspend provision, which for somebody who was over the age of 66, which was the current full retirement age, they could come in and file a retirement application and suspend their benefits, so stop receiving them, in order to have a spouse be able to file for benefits on their Social Security record. I mentioned about the independently entitled divorced spouses. They have that exception that the number holder doesn't have to have a requirement to file for benefits. Well, if you are currently married, the requirement is in order to get benefits from your spouse's record, they have to file. So in order to sort of circumvent that, they have file and suspend. Number holder goes in and says, I want to file for retirement benefits and I want to suspend. They pause the benefits for that person, and then spouse comes in, they file their application for spouse's benefits. They're collecting their 50% or whatever the case is. Meanwhile, the number holder is keeping their own benefits on pause, and when their own benefits are on pause, they can be earning delayed retirement credits. Okay, if anybody's heard of those, we'll unpack those more in a little bit too. For delayed retirement credits, it's 8% per year gain year over year, 66 to 70. So meanwhile, spouse is collecting a benefit and the number holder is maxing out their own. So they got rid of that. Okay, so we don't have that. Now, what you can write on there is if somebody files and voluntarily suspends, everybody's suspended on the record. We can't just pause one person's benefits. If the number holder files, number holder is getting or they're not, period. And so too, everybody's getting or they're not. Okay, so my civil service friend over there. This is a little touch on something that makes life interesting for you. Government pension offset and WEP. So the other key word that we are going to get to WEP, WEP, windfall elimination provision. GPO is how the receipt of a government pension affects you as a spouse or survivor. WEP is how you are affected by your own pension. WEP is about you, GPO is about you as a spouse or survivor. So that was the first bullet point. And if you receive a government pension based on work not covered under Social Security, your Social Security spouse's or widow's benefits may be reduced. And the note you can make near that is 2/3, okay? WEP is real easy to figure out because WEP has to do with the gross pension amount. You take your gross pension amount and you find out what 2/3 of that is. And the entitlement to spouses or survivors benefits has to be greater than 2/3 of your pension in order to be eligible for anything. Does that make sense? 2/3. There's a 2/3 calculator on the website. It's great. I go there and I just punch the number in, so it prevents me from having to use a brain cell. Okay, calculators are great. Yeah. And so if you're eligible, for instance, let's say you get a pension that's $3,000, because we're going to make the math easy, and 2/3 of that pension is $2,000, and you're only eligible for $800 as a spouse or survivor, are you going to get any benefits? No. And it's because the GPO, the amount of GPO, the government pension offset, we value at $2,000, that 2/3, which is greater than $800. Good. Okay, so you see how that works. We'll talk about WEP in a little bit. So, oh man, I spoiled the surprise. Here's the math. My math is easier. So in this case, they actually kind of described that this pension would be payable, wouldn't be completely offset. I'm going to be honest with you, in this area, we deal with WEP and GPO pretty much on a weekly basis, but where I started in Geneva, New York, we didn't talk about it at all because the only other government employees we knew were each other. Here, we're everywhere, which is really cool. I love meeting people from other government agencies. So the pensions and the pay and the amount of money that we make because of our good government jobs generally make it so everybody's GPO'd. Government pension offset. It's very, very, very rare that I see somebody who actually gets something and isn't completely affected to get zero from GPO. So it happens, but this is the way it works, okay? Now, this is where we're going to start talking about disability and survivors a little bit. So disability statistics. As of December 2017, Social Security paid an average monthly disability benefit of $1,059.63. That's barely enough to keep a beneficiary above the poverty level, which is $12,140 annually. According to Census Bureau, 56.7 million people living in the United States, 19% of the population live with a disability, and 13% of the population, 38.3 million people, live with a severe disability that affects their ability to work or complete their daily living tasks. So a quick touch on disability. Some people refer to it as SSDI. And what it is a social insurance program under which a worker earns coverage for benefits by working and paying Social Security taxes on their earnings. And who is it for? It's for disabled people who have not attained full retirement age. So our full retirement ages are 66 and up right now, or age 55 for certain blindness cases, with an inability to perform substantial gainful activity work because of a medical condition that is expected to last at least 1 year or result in death. And you have not earned have earned a certain number of quarters of credit to work. The minimum is 6 QCs, maximum is 40. It depends upon your age. So if we're talking about a person, a couple months ago I interviewed a young man who had a very tragic accident. And he was young, and he was a tow truck driver and like a roving mechanic. Seemed like he was a pretty cool, skilled guy. Well, he had this medical issue, and he's no longer able to work. He can't walk, he can't breathe, he's in really rough shape. But because of the little bit of work that he had, he was insured enough to get Social Security disability rather than being on SSI. He only needed 6 quarters of credit, which is about 1.5 years of substantial work, if you will, in order to get that insured status. So because we have those fluctuating rules based on age, he was able to benefit from Social Security disability, which is great. And he's actually doing better. I saw his mom in the office not too long ago. He's moving along, but he was in pretty rough shape. So that's just a little overview of Social Security disability. Now, here's the survivors bit, so we'll cover a little bit about this. So there are 3 kind of categories of survivors that we talk about. Children, disabled children, which I touched on a little bit earlier, right? About the 18 to 22 and all that. And then the widow or widowers, divorced widow or widowers. Children, they may receive benefits if they are not married and are under the age of 18. If they are older than 18, but still in high school, those fall babies, sometimes kids end up with those fall birthdays, and they're maybe a little shade older than their peers, they can continue to receive benefits until 19 or graduation, whichever happens first, as long as they're a full-time high school student. And then disabled children, as I mentioned, we talked about those guys. They're over the age of 18, but found disabled prior to the age of 22. They have to be unmarried and have not earned something called SGA, substantial gainful activity. SGA is a limit that we have for benefits that is rated at $1,220 gross earned income a month. So if someone is earning greater than that, they cannot be considered disabled under Social Security law. Okay, I'll throw that statistic out at you. Full benefits and full retirement age, or reduced benefits at age 60 for widows and widowers, and divorced widows or widowers. So that's one thing that makes survivors' benefits different, is the earliest point of entitlement is age 60. So you might want to either circle that or jot yourself a note. The earliest age for retirement is, does anybody know? 62. 62. So 62 is regular retirement, survivors is 60, okay? If you think about the origins of survivors' benefits, they came about during a period of time where men were doing the working, the ladies were home taking care of the house and the kids. Something happens to dad, they're there to help support the household in the event of the main breadwinner not being there anymore due to death, disability, or in this case, also retirement benefits. But in this case, we're talking about as survivors, okay? So that's kind of where that came from. There is also a provision for folks who are over the age of 50 and they are disabled and they are surviving spouses, divorced or survivors that, their marriage ended by that person's death, and they can receive benefits, and they're called DWIB, DWB, Disabled Widows or Widowers Benefits. That honestly is a tough category to fill, but we come across them every once in a while. And again, like I said, during that interview process, we ask you a million bajillion questions, and the whole reason is to find stuff like that, because if you are a surviving spouse and your spouse did a lot of the working and you don't have a ton of work, maybe they've got better benefits to offer you. Might as well go get them, right? At full retirement age, your spouse can receive 100% of deceased workers' unreduced benefit, or at 60, the reduction goes to 71.5% of your full benefit. So age reduction does apply even if you're age 60 and you find yourself as a survivor. You're going to take the most age reduction that we can possibly put on that benefit, but it is your earliest point of entitlement to that benefit, okay? We take, the pros and the cons are always something I'm telling people that I interview to weigh, is that do you want, you can collect benefits longer if you file sooner. The amount of money is smaller, trade-off, but if you're deceased, you can't collect benefits. So you make the trade one way or another. Let's see. Okay, so this page, this other survivors' benefits, I'm going to mention parents' benefits, but I can tell you I've never met a single person who has ever filed a parents' benefit application, including myself. Parents' benefits, a very super duper narrow field of entitlement. The parent has to be over the age of 62, and they have to be receiving at least 1/2 of their financial support from the person who is deceased, son or daughter. That 1/2 support is really tough to make work, which is why we just don't see it like ever. But it's there. So if you think you find yourself in a situation where that might be it, come and talk to us and we can dig into eligibility. And then the last thing for survivors, which I think is the most common and really important, is called lump sum death benefit. And the payment amount is $255. It's been the same since the 70s. It might have bought you something then. But the $255 is what you're eligible for if you are the surviving spouse who is living with the person and married to them at the time of their death, okay? So surviving spouses living with them and married at the time of their death are always first in line for that. So we'll file that application. Now, even if that person has like 5 surviving kids, but they have a surviving spouse is the only one who's going to get that $255. There's only one to pay out, okay? So adult children, surviving children, like if one of your parents passes away, you can't get the $255. It's only the spouses, okay? Some people call it the funeral benefit. Some funeral directors kind of make it sound like they filed for it for you. They don't. You have to do it. But it's really quick and easy. This is one of those things that if you know it's the only thing that you got to do, call and make a phone appointment. We'll take care of it for you, okay? It's an easy thing to take care of. And again, you or your loved one paid into Social Security with their FICA taxes. You're their FICA taxes. Go get it. You're eligible for it. So it's just that $255 lump sum death benefit. This slide I happen to really like because it's a compare and contrast for living spouses versus survivors benefits. So the first lines are the 60 versus 62, which we already talked about. Survivor starts at 62, so we give you a little bit of a 2-year break. Retirement benefits start at 60 versus 62. Sorry if I reversed my numbers there. The highest benefit amount that a survivor or a living spouse, you're alive and they're alive, can get is 50%, period. If everybody's alive, nothing higher than 50%. Okie doke? The lowest that a survivor can get at age 60 is 71.5%, and the highest that they can get is actually, it's not completely true, 100%, but then there's some other exceptions where you can get more than that based on delayed retirement credits, and that's not very common, but I think there is a situation like that described later. But do you see, don't forget about the duration of marriage requirement for a living divorced. Divorce, when we're talking about divorce, it always has to be 10-year marriage requirement from the date of marriage until the date of divorce, okay? We don't recognize common law marriage, by the way, in Maryland, so that's not a thing for us. We want to see a marriage certificate. We want to see a divorce decree. Auxiliary benefits for children. So a child must have a parent who is disabled, retired, or entitled to Social Security benefits, or a parent who died after they worked long enough in a job where they paid Social Security taxes. The child must also be unmarried, younger than 18, 18 or 19, and in high school, or 18 or older and disabled. The disability must have started before the age of 22. Those are those childhood disability benefits we were talking a little bit about earlier. So auxiliary benefits, when we say that, we're talking about children. Okay, so this is where we kind of start getting into the nitty-gritty of retirement stuff. You can switch to retirement as early as 62 if that benefit is higher than your widow's or widower's benefits. So let's say at age 60, you've become entitled to survivor's benefits, and at 62, you weren't eligible until 62 for your own retirement benefits. If your own retirement benefits are much higher than what you're eligible for as a survivor, you can switch over and take the retirement benefit. So you're not you're not required, okay, but you can. You can also wait until your own benefits keep going higher too. So we're not going to miss your retirement party. I love doing retirement interviews. They're my favorite thing. Some more did you knows. As of December 2017, 42.4 million retired workers are receiving $59.6 billion. Wow, that's a lot of zeros. In Social Security benefits per month. At the same time, 3 million dependents of retired workers are receiving $2.2 billion in monthly Social Security benefits. So we're talking about children who are under the age of 18, children who are over 18 and found disabled, children that are in that student gap, and we've also got the spouses in that bit there. Let's see what else we got. Okay, this next slide is where we're actually going to start making some amendments to numbers, okay? So how do you qualify for retirement benefits? The first question I ask myself whenever I start a retirement interview is, can I pay this person? And how do I break that down? First of all, the thing I want to know is, how old are you? So we know for retirement benefits, you got to be at least 62, okay? So 62 is the youngest you can be. The way that you qualify is you've earned enough. So we covered the are you old enough? Have you earned enough? So it says you got to earn 40 credits, 10 years of work, and you must be older than 62. The QCs, now you showed me your benefit information there. Has anybody received in the last couple of years or gone online and seen their benefit statement? So, yeah, good. So when you see those, or we're not sending them out in the mail for everybody anymore. We stopped that a few years ago. But those are really cool because that is the information that we use to figure out, are you eligible for benefits, how much and when and all that stuff. It breaks it down into a really friendly looking thing for you, but what we see at Social Security isn't quite so pretty. We see C's for quarters of credit, and you got to have 40 of them. For retirement, we don't care when your quarters of credit happened. So for somebody who perhaps, one of my friends keeps threatening to do this. He's like, I'm going to work like a crazy person for the next 10 years, and then I'm going to retire, and I'm going to buy a boat, and I'm just going to like be that weird expat cruising around the Caribbean. And I'm going, okay, cool. well, will I have enough to retire? I said, well, yeah, you probably, by now you've worked 10 substantial years. I'm in my mid-30s, so my friends are about the same age. And it doesn't matter when his QCs happened, if he decides to float back here at the age of 60 and finally file for retirement benefits. As long as he's got his 40, we don't care when they occurred. Okay, and then he can file for retirement benefits. He hasn't done it yet, by the way. I'm still waiting. So the cost of a credit, this is where the change starts. Each $1,360 earned in earnings gives you 1 credit. So it shouldn't be $1,320, it should be $1,360 as 2019's amount. So if you think of that as like the cost, okay? So in order to get 4 quarters of credit, so the very last line in the little italics, note to earn 4 quarters of credit in 19, you have to earn at least $5,440 gross earned income, okay? So make sure to make the changes to those numbers. So you can obviously only earn 4 quarters in a year, and that's, the $1,360 again is the worth of a quarter. The next couple slides get into how we calculate your benefit, and there are some publications on SSA.gov, socialsecurity.gov, that go into a nauseating amount of detail about how we calculate your benefits. You can read that if you want. It is really kind of interesting to look at. There's a lot of math involved. Thankfully, as claims specialists, we don't have to do this by hand. Thank goodness, because it's gross. So this is how we calculate your benefit. Your benefits are based on your earnings. Your wages are adjusted for changes in wage levels over time. The fun buzzword there is called indexing. We find the monthly average of your highest 35 years of earnings. Now I know as feds, you guys do high 3, high 5 and stuff to figure pension. Social Security does high 35 years of indexed earnings. And it results in a figure called AIME, A-I-M-E, average indexed monthly earnings. So the indexing, to give you a colorful example of that, if you worked sometime in the 70s and you earned like $5,000, it might be worth like 20-some thousand now. Okay, so we take yesterday's earnings and put them in today's dollar values. We do a couple things with applying something called bend points, which I think comes up in a couple slides here. And that's how we figure out a monthly benefit amount. So this question is one that people ask all the time, which is, what is the best age to start for Social Security? And I can tell you that there's never one answer. And whenever you go online and you search for Social Security retirement type articles, all the things that come up, if they claim that there's one magic answer, they're wrong. It all depends on what your personal choices and circumstances are. You know that if you take benefits early, your benefits are going to be reduced for your age, okay? So you know that going in. However, as I mentioned, you take the good with the bad. The good thing is you're receiving benefits. It's the lowest amount you can get, but none of us, as I usually mention during interviews, none of us have a expiration date tattooed on our foreheads. So therefore, if you are waiting and waiting and waiting and you never get to the point where you file for Social Security before you kick the bucket, you didn't collect any of your Social Security, right? On the other hand, if you're collecting the lowest amount that you can and you live to the ripe old age of 138, you're getting the smallest amounts you can, but you're collecting it for the longest you possibly can, okay? So you have to weigh the advantages and disadvantages. And the funny thing about interviewing people, I see people from all over, all kinds of different jobs, and I think that's probably one of the best parts of my job is I get to meet people from anything, everywhere, doing anything really. And when they, come in and they're like, I'm 62, and some people look like they just had a rough life, and they're just making it to 62, and there's like, it's time to file, and I'm like, okie dokie, or maybe they have some health issues, and I hear a lot, oh, my parents didn't live until, they didn't make it till 70. Well, in an actuarial way, which I have a friend who's a retirement and like finance planner, in an actuarial way, he looks at data like that. But then there are some people who come in and they're like, I'm 70 years old, and they look like they just got done running a marathon, and they just put their bike up on their bike rack and come in and they're ready to file. Holy cow. So, they've got what they think is plenty of living to do, but they're also getting their maxed out benefit. So it's a personal choice. It's dependent upon your personal circumstances. And then in the last few years, unfortunately, there are people who come in and they are saying, well, I'm 60-something, and I lost my job, and I didn't plan to be in this position, but I need money, and I know I'm eligible. So let's go ahead and file that application, because they know that it's income available to them. And then we can very carefully discuss what happens. Let's say that you find that, that job, you get hired next week. It's sort of like when you carry an umbrella and it doesn't rain. So we're carrying the umbrella, we're filing for benefits, and all of a sudden they come back into the office and they go, hey, I got a job, but now I'm over the earnings limit. What do I do? So we have some ways to get around that. So here you can see a sort of a spread of how your benefits change over time if it's based on a $1,000 benefit. So you see at 66, it's $1,000, so that's your middle point, okay? That would be called your PIA, okay? 70 is increased by 32%, which is the 8% per year, year over year, 66, 67, 68, 69, 70. And then sliding the other direction, 1,000 down to 750, you see the 25% reduction because of age. Does that make sense? Does that give a little bit of context? I know this is probably an answer to some of the questions that you had, is what does it look like over time? And we have a tool in the office that you can come in and ask us to go over with you, called a benefit matrix. And all that is just a calculator program that we plug your PIA into, and then we can give you an example of what your benefits would be at a variety of ages. So feel free, if you come to visit a Social Security office, to ask for that. I like to use them as something to draw on, so that way I can give you ideas and milestones and things like that. On we go. So full retirement ages. Anybody know that they were changing? Had you heard about that? No? Surprise! So the full retirement age is scaling up from 66 to 67. Is anybody in here full retirement age is 66 if your birthdays fall between 43 and 54? You don't have to share your ages, actually. Just know that that's you. Anybody born in 55, 66 and 2 months? All right. 66 and 6 months is 57. So it's my dad. My mom is in the 56s. 58 is, 66 and 8 months. And then we jump 2 more months for people born in 59 to 66 and 10 months. And 60, anybody born 60 and after is at 67 for their full retirement age. Now, Congress has not reached any decisions to continue scaling up the full retirement age at this point. So this is what it is. Now, prior to 43, the full retirement age was lower. It was scale up between 65 to 66. So some of the old timers now that we're seeing for like survivors benefits, around that age, some of them are coming in and their full retirement age was 65 or something. Okay, so now you see what that's like. And the reduction on that ranges from 30 to 35. So Social Security retirement is meant to be a part of your retirement income or Social Security benefits in general. So we're also talking about things you should plan for, like other income, passive income if you can find it, savings and investments, our TSP, 401k, 403b, Roth, blah, 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 pension, hooray for pensions, Social Security. We have a lot of great tools as federal retirees of the future to help us. But it definitely does take a little bit of nurturing to make sure that you're on track to look into the future and like what you see. Do you guys have EBIS? Same thing? Yeah? EBIS is cool. Check it out. Look at your TSP. Make sure you're on track and you like what you see, because it'll be here one day. This is mymoney.gov. It's a cool website. It's a good, unbiased source of financial information and news about planning for the future. I go here every once in a while just to see if there's anything new. I really like some of the factors of the, as I mentioned, it's unbiased. It's not being told to me by the investment people at my bank. It's not colored in the way that T. Rowe Price or, TD and all that are capturing their products in a way to make them appealing to you. So go get some good money information from here. 1-800-FED-INFO apparently is the number for that. But mymoney.gov, I think it's pretty well maintained. So there it is, one tool. We have some good online calculators at socialsecurity.gov or ssa.gov. Use them. WEP and GPO are good. Calculating your earnings, early or late benefits. So those are some things you can look at there. 2018 retirement benefit formula. So the key word that you want to put next to these little pie charts are called bend points. BENDPOINTS. Bend points. So the first average monthly earnings, the prior couple slides ago, they talked about how we get to that AMI figure, the average index monthly earnings. So then we take that and we apply these bend points. So this is where things get a little weird for calculations, manual calculations. And this is how it is generally figured. So they take the average monthly earnings of $5,500, and the monthly benefit amount that they boil that down to is $2,261. I'll give you guys a minute to absorb that stuff so you can take the numbers in and how they're used. Okay. So we're going to take a hop, skip, and a jump and talk about WEP, Windfall Elimination Provision. Now, I mentioned to you earlier that GPO is how you're affected by government pension. This is only if you're civil service. GPO affects you as a spouse or survivor. WEP, on the other hand, affects you because of your own receipt of a government pension, not covered under Social Security. So this is good stuff for everybody to know, so you know how it is. But definitely, if you're in the system as a civil service annuitant or going to be retiree, this is where your ears should perk up, because this is you. So any part of your pension based on work not covered under Social Security, that's the key word. You didn't pay Social Security taxes on those earnings for one reason or another, you may be affected by WEP. WEP can apply if you reach age 62 after 1985, or you became disabled after 1985, and you first became eligible for a monthly pension based on work where you didn't pay Social Security taxes after 1985. So if you started working for the federal government after that, or you chose to switch to FERS, then might put you in a, if you chose to switch, it might put you in a situation where you're called civil service offset, which we would want to see you in the office and very carefully calculate your benefit information, because the amount of work that you had under FICA versus what you have under this pension system, that matters to calculate your benefit. And I won't go too much further than that, because like I said, that's the far reaches of where things get a little goofy. The people, like I take my mother as an example. My mom worked for Social Security, and she was a lifer. She had 37 some years in, and she retired in 2012. and she had only worked like 2 summers at a grocery store when she was 16. So her earnings record would look kind of blank according to FICA because she always worked at Social Security. She didn't work outside of Social Security, so she never paid FICA taxes on her earnings because she was only paying into that pension system. Make sense? And then I take myself as somebody at the other end of the spectrum because I've only ever worked under FERS or in the private sector. So any dollars I've ever earned in my entire working life, I've always paid FICA taxes. And then we have some people like my godmother she worked for when it used to be HICFA. Is that a blast from the past for anybody? And she retired really early, and then she went out and she's a real estate agent. And so she's been doing her thing out in the real estate world. So she's a blend between the two because she's got her Medicare qualified government earnings, not covered under Social Security. She's got her private sector earnings from her real estate thing. And then the two of them kind of combined in a way where we would evaluate the fact that she did both of those things, and WEP would apply to a Social Security benefit. So one other vivid note is, for instance, like my mom cannot collect Social Security benefits because she's essentially never paid FICA. She has a little job now, but she doesn't have her 40 quarters of credit. That's kind of the simple way to look at that, okay? So she can only draw her pension. She gets her pension, and that's cool, okay? I, on the other hand, I will be able to collect Social Security benefits because I've always paid FICA. My godmother, she collects some Social Security, and she's got her pension from healthcare finance. And so she is affected by WEP. So the amount of Social Security that she's worked and paid into Social Security under FICA is lessened by the pension that she receives. And I think that might be kind of on our next slide. Yes, it is. Okay, let's see if this will clear the mud a little bit. So the normal computation when you get to the bend point is 90% of the first $895. Instead, my godmother, on the other hand, is affected by this 40%. So the first bend point is where the big things change, and the value at which, I wrote myself an interesting note about this to try to find a way to digest this. The next slide is actually even better for it. We're going to look at that. So max WEP loss for someone who turns 62 and 18 is 448. But the note I wrote myself was, effectively, you're increasing the percentage of earnings we count in the first bend point, the more that you work and pay into FICA if you are somebody who is under civil service. Okay, so otherwise you are hit as hard as you possibly can with that 40%, which is at the bottom. And if the years go forward and you are earning years of substantial earnings, which have to be over a certain amount, and I want to say in 2019 it's like 26,000 something. Let me see if I have it on my data sheet. I don't think I have it. Sorry. It's a very strange number. It's not like a round number like 1,000 or 2,000. So I haven't stuck that one in my brain to commit to memory. But so for instance, like I said, my poor family members, they get talked about by me all the time. So my godmother, the more that she works and pays into FICA, the less and less WEP affects her because she's earning her substantial years of earnings, which lessen the push down of WEP. Does that make a little more sense? There's a WEP information sheet on the website. There's also a GPO information sheet. Highly recommend you to download those and check them out for a little bit of a better explanation. And also go visit your friendly local Social Security claims specialist, and we will be glad to explain how it affects you if it affects you, okay? So I'm going to leave WEP and GPO alone because they're kind of confusing. If there's any questions that come up about them at the end, I'll do my best to answer them in as detail as way possible. This is another slide. We're going to make some changes. Now, I'm going to be talking about our friends in private sector first. So civil service people, definitely you can still listen, but this is directed mostly at the the FERS folks or folks who are, private sector insured. If you are working while you're receiving Social Security benefits, if you're under full retirement age, so the youngest you can be is 62, you can make up to, this is where we're making the change, $17,640. So just make a little tail on the 0 and make it a 6 instead of a 0, $17,640 a year. So what I would tell you if you were coming in to see me for retirement counseling, I would say, oh, are you working? And you would say, yes. And I'd say, well, how much are you going to earn this year? That's usually my first question other than, can I have your ID, is are you working? And you're going to tell me how much you're going to earn, and I'll say, well, you're under full retirement age, so your earnings limit is $17,640. Gross earned income, okay? Or net earnings from self-employment. So for every $2 over you go, $1 of benefits is withheld. So if you're coming in and you're telling me, oh, I earn $70-some thousand a year, and you're only age 62, does it sound like it's a good idea to file for retirement benefits? No, because of the earnings limit. The earnings limit is basically telling you, we're not going to pay you anything. So bad thing is, we lock yourself into a lower benefit rate because we're filing for benefits based on age 62, and we know based on age 62, your benefits are what? They're reduced for your age, right? Yeah. So at full retirement age, in the year you turn full retirement age, so we're going to skip further ahead into the future or into the present, wherever you happen to be, the number instead of 45,360 should be 46,920, 46,920. So the example for this would be somebody who was born in 1953, and this year they are going to reach their full retirement age, and we're going to give them a June birthday, because that's when my birthday is. And so therefore, in the months before their full retirement age month, so their full retirement age is June, at 66, turns June 66 in June. So in January, February, March, April, and May, January through May, in the months prior to full retirement age, the earnings limit is that $46,920. Yeah, holy cow, that's a high earnings limit. Do any of you earn $46,000 in 5 months? Maybe, you might. So if you do, is it a good idea to file for benefits anywhere in January to May if you're going to go over that? No, probably not, because again, you're locking yourself into a lower benefit rate and we're not going to pay you. That's the whole idea of filing, is for us to give you money, right? So that's before you get to that full retirement age. And then you finally reach that full retirement age, and here it is June, and you've turned 66. And at that point, the greatest thing happens. No rules. There's no earnings limit, and there's no age reduction. Circle it, star it, be happy about it. It's exciting when you get to full retirement age. I'll tell you, in my experience of the places that I've worked in upstate New York in the Finger Lakes region, I'm not from there, I'm from around here. I'm a Howard County kid. And in upstate New York, the economy is kind of rough, and manufacturing is like the main thing in the area, either that or agriculture. We got a lot of great wine, apples, things like that. But that means that a lot of those people are working in those industries. I hardly ever filed an application for somebody who was full retirement age when I was working there, because people retired early. That's just what they did in that kind of area, in a somewhat economically depressed area. I don't know if anybody's ever been to Geneva. It's a beautiful place. And the office looks right across the very north end of Seneca Lake, and there's wineries. It's gorgeous, lovely, horrible winter weather. Scared my little Maryland self when I moved there. And that was just the way it is, though. 62, everybody was filing for retirement. I could count on one hand the number of applications I filed after full retirement age when I moved back to this area and came to Glen Burnie. In Glen Burnie, I hardly ever see people coming in at 62. A lot of them that I do are generally federal retirees. So just because, you know, we work our amount of time and then we're out. We go enjoy our retirement because of our wonderful government jobs and the nice retirement that we have, right? So every area is a little bit different in terms of demographics. People here are working longer. They're making a lot more money, mostly because it's really expensive to live here. So that's just kind of the way it goes. So every community is a little bit different in that way. So hooray, at full retirement age, no earnings limit, and no withholding for your age, okay? We're gonna move on. Taxation of Social Security benefits. We generally don't discuss a lot of taxation issues at the field office because we don't want to give you the illusion of giving you tax advice. But this is some of the tax information we're allowed to give you. So if you file a tax return as an individual and your combined income is between $25,000 and $34,000, you may have to pay income tax on up to 50% of your benefits. More than $34,000, up to 85% of your benefits may be taxable. If you file jointly, you and your spouse have combined income between $32,000 and $44,000. You may have to pay income tax on up to 50%, and more than 44 up to 85%. And if you're married and file a separate tax return, you probably will have to pay taxes on your benefits. So consult your tax professionals. There's a W-4V form that we use. The current tax rates for federal taxes only. We don't do anything with state because we're a federal agency. So if we're doing any federal tax withholding, it's at the amounts of 7, 10, 12, and 22% are the current set percentages that we're allowed to deduct. It is voluntary, okay? So you can do it if you like because, you know, who likes to pay taxes at the, you know, at tax time, but it is not necessary. For some people, maybe they got tax coming out of a different place and they don't need to withhold more tax. So whatever the situation is, there you go, okay? So there's a good website and some information there is just general guidelines. Your adjusted gross income plus taxable, non-taxable interest plus half of your Social Security benefits is considered your combined income if you needed a math problem to make the other page work. So math problem, refer back to the other page. On we go. Now, Medicare. We're gonna breeze through some bit about Medicare, and it feels funny talking to the Medicare people about Medicare. I'm oddly nervous right now. So in the middle of the page, in between B and C, I want you to put a line. So A and B are above the line, and then C and D. Got it? Really important. A and B are called essential Medicare. That's what we deal with at Social Security because you guys don't have offices for people to walk into, so we do that, okay? We help people get enrolled. We do some servicing bits and things for that. A and B are A and B, period. That is what they are. Now, C and D are different. So A and B, you can write essential Medicare above the line. Below the line next to C and D, you can write privatized. Okay? C and D are privatized. C and D can come from AARP, United, Humana. Turn on daytime TV for 4.5 seconds and you will see a Medicare commercial. Yeah. D is easy to remember. D is for drugs. A is hospitalization insurance. B is for medical, so it covers doctor's visits, lab tests, and the like. C is sort of a wraparound for B. B is supposed to cover about 80% of healthcare expenses. C is supposed to cover, the commercial thing they say is about the rest of the 20%, right? D is for drugs. Thank goodness they made that make sense, right? So A and B are what they are. C and D are privatized. They can be called Advantage plans, Gap plans, donut hole coverage, whatever. I mean, there's so many different names out there, which is what makes it really confusing for the average human being. My friends think I have a secret power because I deal with Medicare on a daily basis. I don't. But insurance is really confusing and weird, and it doesn't get any less confusing and weird when we're talking about Medicare and after employment. The way I like to describe Medicare is it's sort of like a Chinese menu versus our comprehensive healthcare plans. Our comprehensive healthcare plans at like Aetna, Blue Cross, Blue Shield, United, GIHA, and all those things, you know, we have those nice things now. They include hospital, they have medical coverage for your doctors, they cover this, a little dental, a little this, a little that. Medicare, you have to buy in pieces based on what you need, okay? So you buy all your pieces, a little from column A, a little from column B. You know, you gotta have some rice or chow mein, you gotta have an egg roll, whatever those things are for you, you gotta pick on the open market. Medicare.gov is a great place to shop for those on the Medicare C&D plan sources. And there's also a fantastic guide, whether or not you know about your own website. There's a great publication called Medicare and You. Has anybody seen that? It's like a book. It is the most fantastic thing, and I so miss getting it in the office because I personally would hand out like all of them, and our clerk would get mad because then we'd run out of them real fast. But it is downloadable, and I highly recommend it because it does take the time to break down A, B, C, and D. What does it mean for you, services covered, and all that, okay? There's different ways to become eligible for Medicare. The main one is age 65, and then there's also an eligibility point for folks who are disabled after 24 months of entitlement to disability. So that's another way to become eligible for Medicare. People who have ALS, people who have end-stage renal disease. Agent Orange used to be a thing. Now it's kind of working its way out generationally. And environmental health hazard exposure. I think that's kind of where they calculate, you know, they put that under. Like the 9/11 survivors, folks, that's one of the things that they're talking about is trying to look at healthcare coverage. It's a hot issue because obviously they're facing some serious healthcare concerns. So that's how you get to Medicare. There's 3 ways to enroll in Medicare. And so we can make a couple notes there. The first thing that you encounter, and you can put beside that 7 months, is your initial enrollment period, which is the 3 months before your 65th birthday, your birthday month, your 65th birthday month, and the 3 months after. So again, we're going to use myself, the June baby, as an example. So my initial enrollment period for Medicare would be March, April, and May, my first 3 months. June is my 65th birthday month. July, August, September would be my back 3 months. So you really have a 7-month protected window, which is your first contact with Medicare to enroll in Medicare. And then we have the special enrollment period. This is for folks who are working still past the age of 65, and they have Medicare, or they have healthcare coverage because they are working. So you can write a note there. It's an 8-month protected period. Okay, it's 8 months protected period. And the important thing about that is that you have to, in order to qualify for special enrollment period, you have to answer 2 questions, yes. The one is, are you working? The other question is, do you receive health care because you are working? And actually, this health care and the working can come from a spouse as well. If you are providing coverage to your spouse and your spouse is getting to 65, if you are doing the working and you have health care coverage that covers them, they can delay their enrollment in Medicare Part B. Really, we're talking about Medicare Part B here, okay? Medicare Part B is the problem because Medicare Part B costs money. Part A is free. I don't know if I mentioned that. I am sorry if I glazed right over that. Part A is free when you've worked and paid into Medicare with your taxes. So you get your 40 quarters of credit, you get Part A for free. Or you've already paid for it, is really what it is. Medicare Part B is $135.50 is the current premium for Part B. So if you or your spouse is working and covered or covering you, then you can delay your enrollment in Part B until one of those things isn't true. Let's say you are the one that's working and covering and you finally decide to retire. At that point then your spouse or you has an 8-month protected window to enroll in Medicare Part B, and the 2 buzzwords within that are There's no significant delay in obtaining coverage, which means the earliest you can get it is the month after you enroll. So if you hand me your forms today in the office, I can give you Medicare Part B beginning July 1st. So that's no significant delay in obtaining coverage. And we'll talk about the other thing about significant delay in a minute. And the other thing is you pay the current premium for Medicare and there's no penalties. So as long as you're protected under that period of time, we can give you Medicare Part B at the current price, which happens to be $135.50, in the next earliest as the next month, okay? But you have 8 months to kind of wait it out if your coverage, let's say your employer is really generous and they're gonna give them 3 months of insurance coverage. I don't know any of these employers that do that. But if that's the case, then they're gonna wait out their insurance coverage. Why pay for double, you know? So you wait that out a little, but you're still in your protected bubble of 8 months, okay? Cool? Okay. General enrollment period, I don't want to pose as like the bad guy, but it kind of is a little scary. Think of it as open enrollment in a way. It's January through March of a calendar year. And one note that you can put by that is July is the start date. So people who did not take Medicare Part A or Part B this year, the next enrollment, and they don't have a special enrollment period, the next opportunity that they have to enroll in Medicare Part B is general enrollment period, which begins January 1st of 2020. That's our next January coming up. The period runs until March 31st of 2020, but the coverage doesn't start until July 1st of that year. July 1st, 2020. Yikes. Because that means you gotta wait. And for every 12-month period you didn't have Medicare, and you shoulda, you're assessed a 10% premium penalty for every 12-month period you pay for the rest of your life. Ugh. So you're 5 years late, you're paying 150% for Medicare. Gross, right? Okay. Play by the rules, ask questions, and avoid penalties. That's the game, okay? Onward. So if this approaches a topic which is very common in this area because of the amount of monies that we earn, is called IRMA. So I don't know why that isn't on anywhere on the slide, but the acronym is IRMAA, IRMA. And I'm sorry if there's anybody in the audience named Irma, but I'm sorry, we don't like IRMA, because IRMA is not nice, because IRMA is an extra charge for Medicare. The standard premium for Medicare is $135.50, and the lowest extra premium that we get is, so you can make a correction. Instead of $134, it's $135.50 is the standard premium. And then the lowest extra charge is $54.70, I think. A number I didn't commit to memory. But if you are in one of these categories where your modified adjusted gross income for you, or you and your spouse if you're married jointly, or if you're married filing separately, wherever you fall, there will be an additional charge for Medicare. So this is how Medicare is affected for higher income beneficiaries, okay? There is a pamphlet about this, the form to look at if you ever need to request a different decision based on something called life-changing events. The form is called an SSA 44. And we can take a look at that with you. So if this affects you, please go see somebody in a field office so we can take a look at that and see if we can adjust the amount of IRMA you're getting charged. And here's the Medicare.gov website. Again, hi Medicare people, you might have seen this before. So use your fantastic website. I go to your website quite a bit just to answer questions. Use the guides. I may or may not have stolen some graphics because they're really good for the IEP enrollment. Yeah. And then, so you've seen your website, good. Extra help program. Now this might not apply to you, but if you know somebody who could be helped by this, the extra help program is where the state of Maryland will assist the person in paying their premiums for a Medicare Part D plan. It doesn't pay for their medications, it pays for the plan to help defray the cost of medications. Make sense? Okay, so that Part D, sorry, the screen went black. That Part D Extra Help program can be applied for at a Social Security office. We would ask income questions. It can be an appointment over the phone for a friend or family member who might be able to be helped by that. Generally, I won't say generally, a lot of times we can get an immediate decision to tell you whether or not that they qualify for that type of assistance, and it can be either 100% coverage. There's also subsidies of 0, 25, 50, I think. But anyway, it can be either a lesser amount than 100 or anywhere in between to provide that assistance. We're here for your family in the future, and a lot of things that people want to know too is with the key word for the next slide is solvency. Okay, this gives you some statistics about solvency. So up through 2035, we're considered solvent at the current benefit rates. Stuff's going to have to change. We've been through changes before. We'll be through changes again. That's kind of like the way it goes as a federal worker, right? Yeah. We read a lot, things change a lot. Our elected officials do the changes, and we roll with it, which is, I think, something that kind of binds us as federal employees. There's kind of a common culture that it's just the way it is. Change is going to happen, and you just kind of go through it, right? Ways to apply for benefits. Come into the office, call us. That's a general number, 800 number. We have 13 call centers throughout the United States. They are open 7 to 7, Monday through Friday. Or you can apply online. You can apply online for retirement, disability, SSI with a lot of exceptions, but retirement, disability, and Medicare are the big online applications, so go for it. Applying for Medicare online is very easy, so easy. Try it out. And if it makes you feel better, when you file an application online, it comes to a real human being at your local office. Or we also have work groups in Denver and in Boston. So if something goes onto the online application that makes us go, what? Huh? We will call you and say, can you give me some background on what you're thinking so we can make sure you get what you need to get? I've had that conversation lots, and it's fine. It usually comes down to, oh, well, this is what I was trying to tell you. And it's totally cool. We figure it out. We process the application. You never had to come into the office, and that's great. You didn't have to wait in the lobby, and fantastic. Hooray, hooray. Oh, by the way, our business hours in the field offices, and we have lots of field offices in the area, are Monday through Friday. We open at 9 every morning. Monday, Tuesday, Thursday, Friday. We close at 4, 9 till 4. On Wednesdays, we close at noon. We don't go home. It's just our time for meetings and work. Wednesday's our weird day, just remember that. Okay. So here's the Social Security website, isn't it nice? And lots of great resources there, just like the Medicare website. My Social Security, does anybody have a My Social Security account? I know you do, because we saw that. Yay, okay. Good job. I'm glad to see, it's nice over time I've seen more hands start popping up in the crowd. I'm so happy to hear that you have one, because there's a lot of good stuff on there. If at very least, even tell your kids to go online and look at their earnings, so that way we make sure that all of the money that goes into creating your Social Security benefit is right. Makes sense. Check out all of the guts of it to make sure that the end result is going to be correct. So open a My Social Security account, and here's some of the things that you can do on there. You can change your direct deposit, request a replacement Medicare card, get a 1099, request a Social Security card, as I mentioned before. Like I said, there's a lot of exceptions, and if any of the exceptions come up, you just come in and see us, okay? You come in and see us with valid photo identification, and we can take care of that for you. Report your wages, which is a new thing. They haven't given us a lot of details on that because we're not ready to go completely crazy with all the things that are available there. But these are some of the things that if you don't have benefits, so the other things were if you are getting benefits, we got a lot more services connected to that. If you don't get benefits, you can still do these things. So you have that for you. There's multi-factor authentication now, which is we are using your cell phone or an email to send you a code and make sure it's really you. You do have the opportunity, if you wish, that if you wonder about the safety of your online account, if you simply don't want to deal with online ever, you can come into an office and request a block electronically. That means, though, that you have to come into the office and transact any business with us in person with photo identification with you. But for instance, a lot of older folks who are not going to use some of the online services, block their online services available. So that way it simply takes that out of the equation for any fraud issues. It's available, so I think you should know about it. So each time you sign in, it talks about the multi-factor authentication. And some more things. I think I might be missing a couple pages up here. Anyway, so this is how you create your My Social Security account. And we're with you through life's journey. And this is the part I've been dying to get to because I want to know what you want to know. Questions and answers. Sorry if I buzzed through those last couple pages, but I want to know what you want to know, and I hope you enjoyed it, and I hope you learned something. Hop up to the mic.
So Stephanie, for
Yes.
the Q&A session, if the folks in the room would use the microphone in the center aisle, that way folks who have dialed in can also hear that question, and then we'll take questions in the room, and then we'll go to the phone to see if we have some questions, and then we also have some questions through our email inbox.
Wonderful.
All right, we'll start in the room.
So I was born in 1955. My current plan is to continue working at CMS full retirement. Can you touch on the Medicare special enrollment period window again, and how that applies to my situation, because I will still be receiving CMS benefits at 65.
Right. So for you, if I was interviewing you, what I would tell you now is that next year is when you turn 65, right? So next year, and when's your birthday? What month? Sorry.
Mine is in November. Spouse's is in May, so this is a kind of a joint question, if you will.
So for you, now is spouse turning 65 in May?
Correct.
Okay.
And I turned 65 in November.
Okay. So everybody's 65 next year. So what you can do is you both, now do you provide her health care coverage?
I do.
You do, okay. So what you guys can do is you can both enroll in Medicare Part A only if you wish, and then while you're continuing to work, you can keep providing that healthcare coverage to the both of you. The Medicare Part A is free, so you wouldn't be required to pay anything for it, obviously, if it's free. Then what you would do is you would refuse Medicare Part B while you are working and providing coverage to yourself and to her. And then down the road, when you get to the point of not working or not covered, then you would file for the both of you, you would file 2 sets of forms for Medicare Part B, special enrollment period. And the 2 forms you would need for that, one is called a CMS 40B, CMS 40B as in boy, and the CMS L564. That you take to your employer, and your employer indicates there that you've been working, so it tells us when you started working, when you stopped working, if you stopped working, and when your coverage for them and your coverage started, so that way we know to give you a special enrollment period. So the 564 is super important for that. And the 40B simply tells us, I want Medicare coverage, and you put in the remarks section, I want Medicare coverage beginning whenever it is that you're wanting that. So then you turn those in when work is stopping and when you want to enroll, and we enroll you both under special enrollment period for Medicare Part B. You at that point pay the standard premium for Medicare, and there's, again, no significant delay in obtaining coverage, which means that the soonest we could get you is the month after the month you turn those forms in. Is that a little clearer now?
It is, and so let's say I stop working at the end of, at 67 in January, whatever it is. And then I want to enroll in Part B at that point.
Effective January 1st?
Whatever. I mean, I can do that anytime after that. I don't have an 8-month window that I'm kind of locked into, or?
Your 8-month window, you can
had
use
mentioned that
special
before.
enrollment period even if you don't sort of start your clock ticking for the 8 months. So even if the two of you just decide, I just want to take Part B now because I want to sign up for something else, the Part C and D plans, you got to have Part B. By and large, I think there's a few that you don't. But if that's the case, you don't necessarily have to do the stopping working. You only have to fulfill the requirement of having been working up to the point you're applying and having provided coverage because you're working.
Okay.
Does that make a little more sense?
It does.
Yeah.
Thank you.
Thank you. Hi.
Not retiring yet. It'll probably be a few more years. But the question is, have an online account. I lost the password. They sent me a letter. Is there a time limit on when I'm supposed to use that to get another pack? Because I kind of, you know how you get your mail and you just
I'll do that later.
take it to the side. I'm going to get it.
Yeah.
Is it, will I have to redo that process again after some time?
There is
or-
a time limit. I would either go into an office or call teleservice and ask them to either cancel your current temporary password and issue another one, or that's probably the thing to do, because if you've lost it, then it's still out there waiting for it to get renewed. So I would cancel it and start over again with that. Yeah.
Okay. Now, has there been any conversation about making that a phone process where I call in, you send me a code, and then I use it?
Teleservice, there's not any automated services for that. Teleservice, our national teleservice folks can assist with that at the 800-772-1213. And 7 to 7 are their hours, so they're coast to coast, so at some point you'll catch somebody there. Some people say that there's long waits on the phone. I've heard if you jump on earlier or later, sometimes you have a little better chance of getting someone. But if that's the case, I would try that, because I know that they have the ability to request new passwords. And so do we in the office.
And then they'll mail it, it'll be
Yeah.
mailed? Oh, okay.
I think it might even print in the office, but I know for teleservice it mails.
Okay.
Yeah.
And then my final question is, I was federal government, left 13 years in private, came back, and so I have 13 years of, I guess SSA or whatever. How do the two of them, I guess, outweigh each other, or they complement, or what's going to happen?
What's going to happen? Have you ever heard the term civil service offset used?
Yes.
Oh, no.
And it doesn't sound nice.
It's a good way to scare a new claim specialist. What happens is we take the number of months that you had based on your federal employment, and we apply that data to the FICA earnings that you've had and boil it down into a benefit amount. Yeah, I would say that's a good opportunity to go to an office and ask questions, because we need to figure out specifically to you how many quarters of credit do you have under civil service, what do you have under FERS, and where do the two meet in between. Civil service offset questions are real hard to answer without a lot of specific information. And I will tell you that if you're civil service and you are insured for benefits, which means that you have your 40 quarters, or if you're civil service offset, the information for benefits you will see online, your benefit estimator, it's going to be wrong. Okay? So don't get attached. Go to an office, and we can help you out with that, because you happen to be one of the people who are in the in-between. Not like the Stranger Things in-between.
Right.
No Gormagon or whatever.
I like that too.
Me too. But go see us and let us help you out with that, because there's a few more details that we need to apply to sort of scrub that down to what it really is. But yeah, you're one of those folks.
Yeah.
And all set.
In between.
Okay.
All right, so we'll go to the phone lines,
Okay.
and we'll ask our moderator, Zil, to open the phone lines. And just remind those who are not asking a question to keep their phone on mute. Zil, would you open the phone line?
Yes, sir, that's what I'm doing.
Okay, we'll start with questions in Region 1. Any questions in Region 1? Any questions in Region 2? Any questions in Region 3?
Yes, I have a question.
Go ahead.
My question, actually, I have two questions, and they relate to both spouses working. When each person reaches full retirement age, and they're each entitled to their full benefit, whatever that X dollar is there a spousal benefit that each person receives simultaneously, or no?
That's a good question. So both of you, if let's say both of you have like similar type earnings, you're about the same age, you reach 66, we're gonna say your full retirement age is 66, then now if you reach age 62, that going back to that deeming slide way back when, if you reach 62 prior to January 1st, 2016, what you could do is one of you could file as a spouse on the other person's record. So for instance, let's say you take your retirement benefit, but your spouse decides that they would like to take a benefit as a spouse from your record. You're both 66 in this nice textbook example, and therefore your spouse would be eligible for half of what's called your PIA, the unreduced benefit amount, and then you collect your full benefit and your spouse gets the 50%. And then at 60, but at maybe 70, if they want to wait as long as they can wait, then they can switch over and file for their own retirement, which is credited with delayed retirement credits. So that 8% gain year over year. So that way you've gotten a full benefit and they can max out on what their benefits are, all the while between 66 and 70 having collected spouse's benefits. So it helps to backfill the break-even point a little bit. But simultaneously, no, if they wanted to file for full retirement age benefits from their record and you wanted to file for full retirement age benefits from your record, them from theirs, you from yours, then there's no crossover benefit between the two of your records. Does that make sense?
Yes. My second question is, at some point, once each person had been entitled to their full benefit, the spouse dies. So the surviving spouse, of course, is continuing to receive their full benefit. Does the surviving spouse also receive the spousal benefit after the spouse dies?
Great question. So for survivors' benefits, if they are married and living together, the one thing that we had discussed was that lump sum death benefit. So whoever the survivor is, as long as you guys are married and living together at the time of their death, somebody would get that to 55. Remember we talked about that. Then the other thing with survivors' benefits is we would again jump back to that all-important number, the PIA. And the PIA says the relationship there would, let's say that the person's spouse dies and the person who passed away, their PIA, let's say it's like $2,400 and your PIA is like $2,100. Their PIA is higher, therefore you would be eligible for some survivor's benefits from their record because your PIA is lower. So you wouldn't double dip and get yours and full theirs. You would get yours and then the difference between theirs and yours to equal up to, and we're figuring that you're over full retirement age, but you would end up therefore getting what looks like probably close to about 100% of what the higher PIA spouse's benefit amount is. Does that help?
Yes, thank you.
Cool, good questions. Okay.
This is Sam. I have two questions. Actually,
Go ahead.
The first question that I have is, as it relates to collecting veterans' retirement money, how does that intersect with Social Security? And then the second question that I have as you go through this is, so I have an autistic child, and which is totally disabled. How would that work again, and with Social Security?
Okay. So the first question about veterans benefits is, I'm glad you touched on that because the presentation we didn't put that in there. But veterans benefits that you receive as a disabled veteran or as a retired veteran do not affect your receipt of Social Security benefits. So you get what you get from that agency and from there, and Social Security is what you get based on your pay and all that. So that's really good, and that's a good way to honor our veterans. And so does that clarify that bit?
It does, thank you.
Cool. And now the good question that you had about children. A child who is, for instance, has a developmental disability such as autism, if they are over the age of 18 and let's say that they never received SSI as a child because parents' income was too high. So now the situation's different because we have a child that's over the age of 18. So that child then, when a parent becomes disabled, deceased, or retired, so by the time you come file for retirement benefits, we're going to ask you during that benefit application, do you have any children that are under 18? So if in the case, like let's say that kid's over 18 by then, the other question we'd ask is, do you have any children that are over 18 but still in high school, or do you have any children that are over 18 and found disabled prior to the age of 22? So at that point, then you're going to say, yes, in fact, I have a child, and we're going to ask for the child's name and some information, and then at that point, it would kick off the process to file for a Social Security disability under that CDB, the Childhood Disability Benefit provision, which would be able to provide a benefit to them based on the earnings that you have had and your entitlement to retirement if you're deceased or disabled.
How does it work if, let's say right now, for example, the parent now has to stay home to take care of the child because the child's totally disabled?
Right.
Would the parent be able to start collecting Social Security benefits?
So if let's say we're talking about you and you're still working and you are not yet, you're not yet retirement age, I'm going to assume.
Correct.
So there's no benefits available from your record for the child or the parent who's providing care right now from your Social Security record. So this would come when when you become entitled to benefits, because the first thing is you have to become entitled. So what I would say about child entitlement now for a child who's over the age of 18, is your child over 18?
No, he's 16, but we're getting ready for the
okay.
next hit.
Yeah. It's coming.
It's coming.
Oh my gosh.
It's coming.
So perhaps right now the child doesn't apply or doesn't qualify for SSI, perhaps because of your income.
Correct.
So then when the child turns 18, this is pretty common. I'm a generalist, so I also handle SSI stuff. In New York, we had to be generalists because it was small offices. So here, I handle a little bit of both. So SSI, what would happen is when the kid turns 18, you would want to apply for SSI because when the child then is 18, they are like their own little household within the household. So at that point then, when we take an SSI application, we'd start asking questions and say, hey dad, hey mom, are either of you guys retired or either of you disabled, or do we have a parent that's deceased? And then we would look for entitlement based on those Title II programs of retirement, survivors, and disability. So it would sort of emanate from SSI, but then when you reached a point of entitlement, we would want to go ahead and try to grab some entitlement for the child from those sources. So if we're doing our thorough interviewing, which we should do, then we should be asking questions periodically to try to suss out some sort of source of entitlement. But it sounds like right now, no. And then the deeper question that you had with regard to the parent that's providing care, they would have to, there's income limits for that as well. So the 17,640, which is the annual earnings test limit that I mentioned, that is the earnings limit for parents providing the parent with child in care. So if your spouse is working, then it sounds like we probably just want to file for the kid for benefits from your record. But if they're not working, then it might be a good thing to explore entitlement for the parent to be able to, have some benefits. And we would also explore with you too if it would be advantageous to have that benefit split among the, the parent and the child versus just just to the child, depending on the benefit comps. And that goes to a lot of deeper things, dealing with something called the family maximum. But I would say when 18 hits, at that point, when when we want to probably try to look at Social Security or filing for SSI, that would be a good point to start asking those questions and say, what next milestone am I up for? Do I need to start asking for my child for the next point of entitlement? But that's a good question.
Thank you. It's coming. Thank you.
Sure.
Any additional questions in Region 3? Any questions in Region 4?
Yes.
Go ahead.
Yes, I was wondering, I may have missed part because I have gotten interrupted, and for that I apologize. But I'm trying to find out if I noticed she had spoken on age 62 for Social Security, but what if you decide that you want to take your Social Security before 62? What are the penalties for that?
Well, 62 is the youngest you can be and take retirement benefits. So there are no retirement benefits younger than age 62. So any other benefits prior to the age of 62 would be survivors if you meet that requirement. So you have to be a surviving spouse, or if you have a disability. Those are really the only points of possible entitlement prior to the age of 62. But 62 is the youngest you can be and get retirement. And one more point that I'm going to bring up about 62 is that you have to be 62 throughout the entire month to qualify for benefits. So people that are born on the 1st or the 2nd of the month are a little different. I'm one of those people. My birthday's June 1st. So what's your birthday? Of December. So the 23rd
August 11th.
What's that?
August the 11th.
August 11th.
Yes.
So the first month that you would be eligible for, because you have to be 62 throughout the whole month, is September. The first month that you're 62 throughout the whole month is January. There's somebody here with a December 23rd birthday. So it kind of looks like when you start receiving retirement benefits, that your retirement benefits are 2 months behind, but it's just because you start, your first month of entitlement is for you September. So September benefits come in October because we pay a month behind for Social Security. So therefore, if your first month of entitlement is January, February is when you receive your first payment. Now, if you're born on the 1st or the 2nd of the month, we celebrate our Social Security birthday, or what they call attain our age, on the day before our birthday. So technically, my Social Security birthday is May 31st. And I have totally taken this on as a second birthday, and my family doesn't believe me. But this May 31st is technically when I get to my Social Security age. Therefore, my first month of entitlement, because I'm born on the 1st, is June. My first payment would be in July. So people born on the 1st and 2nd, just know that you're a little different.
Okay, now I looked at the website and I did use the little calculator, and it gave me a payout amount.
Okay.
So why would it do that?
I'm not sure why it would do that, unless it's, I'm not sure which calculator.
I went up on SSA.gov, and I used that calculator, and it populated, and I did put my date of birth and what it was, and so it did give me a dollar amount upon me completing all the necessary windows that had to be answered.
I'm not really sure without being able to see the same things for you. I would say definitely don't be shy to go visit an office, but I can tell you that 62 is the youngest you can be and collect retirement. That is the published rule.
So Stephanie, we're coming up on 3 o'clock hour. We've got about 3 or 4 minutes before we wrap up.
Okay.
Let me give you one question out of the mailbox.
Yes.
Can a surviving spouse start collecting a benefit without touching their own Social Security, then at age 70 start collecting their own Social Security, which would be higher?
Yes. That's great. That is excellent planning and looking into the future. So the youngest that you can be as a survivor, as we discussed, is age 60. We talked a little bit about that. So if you find yourself in a situation where you're a survivor and you are reaching age 60 and you are not working because we don't have that earnings limit issue to deal with, then you can come in and you can file for survivor's benefits at the age of 60 or whenever you want to file for them. And you're choosing that benefit over your own, okay? So it may or may not be higher than your own, but you want to choose that survivor benefit. And then at the age of 70, when you have maxed out on your delayed retirement credits, then you're going to flip over and file on your own Social Security benefit and get a fully maxed out Social Security benefit with all those delayed retirement credits. So that's a really great way to kind of play the numbers and look into the future of the highest benefits available to you. Some people will find with survivor's benefits that if we're talking about someone who, you weren't married too long and they died young, and if you think about that, we're taking that short period of time that they had that they're living and earning, and we're magnifying that over a longer period of eligibility. Then, so this short life and these benefits might be really good, and therefore sometimes in the future, your benefits, if you've not worked a whole lot, maybe you were home raising kids or something like that, or maybe you were self-employed and not earning a huge amount of money, looking at the net earnings from that. So in that case, if your survivor's benefits are the highest that you can get, then you just stay there. But you certainly can, if you've gotten yourself into a situation where you are a survivor, you certainly can take a look at the benefits to be able to switch from one record to another and maximize your delayed retirement credits. Good strategy.
Stephanie, what's the best way to reach out to Social Security Administration with these kinds of questions? We've got additional questions that are probably on the phone line. We've not exhausted all of our regions just yet,
Okay.
but we are running up to our wrap-up time.
Yeah.
What's the best way to reach out to Social Security Administration to get these kinds of questions answered, and then we'll close out?
The best way to get personalized information from Social Security is to visit your local office or to call your local office. The claims specialists that work at those local offices are either specialists in SSI or disability retirement and survivors. So we have Title 16 and Title 2. Or you'll run into people like me who are generalists, and I deal across both titles. We are there to help you. We're there to answer questions. Obviously, we work like the same hours that you do. So if you can't reach us there, then you can call the teleservice hotline, and the teleservice folks are really cool because they have to know a little bit about everything. There's a lot of little bits to know. There's a lot of stuff out there. So this job is, really requires a lot of brain capacity to know everything and at least know where to find the answer. So, access those people. Don't be afraid to go in and ask us questions. They can schedule appointments for questions. And teleservice, just for real general stuff or my SSA issues, you can go to the phones for the teleservice stuff. But just know specific benefit situations, your best bet of getting information is going into the office and using the brain power of the people that are there. That's what we're there for.
All right, great. Stephanie, we can't thank you enough for coming over to CMS and presenting on this topic. One, obviously, that people have a lot of passion and interest about for good reason. I do want to remind our participants that our next presentation or seminar is August 22nd, and that's the Federal Employees Retirement System. I think that is it for this. We have one additional question? Okay, so we have one additional question.
Okay.
So one more and then we'll have to wrap up. Okay. All right, so if spouse, husband, passes away and surviving spouse, still working, reaches age 59 and a half, does the surviving wife receive late husband's Social Security benefit, or is it reduced because the spouse is still working?
There is an age reduction because you, the surviving spouse, are younger than your full retirement age. Your age matters. So it doesn't necessarily matter a whole lot at what point the person, the deceased person, your deceased spouse, we don't really make a whole big deal about how old they were when they pass away, but your age matters. So if you turn 60, 60 is the youngest we can be for survivors, right? So when you turn 60, at that point then you would have an age reduction because you are younger than your full retirement age. Between 60 and whatever your full retirement age is, if you're born in 54, then your full retirement age is 66. So between 60 and 66, you have this giant field of age reduction. But as we talked about before, the sooner you file, the more checks you get. Undeniable fact of Social Security. So because of that, you have that age reduction, and the age reduction is permanent. But then a couple questions ago when we were talking about what happens to my benefit or can I take my benefit later, you still have the option for that, to be able to maximize your own benefits. And if you're just creeping up, a couple weeks ago I had a lady who was this was the situation, her husband had died in 2006, and she's retired, and she's like, I just want to take survivor's benefits, here I am, I'm turning 60, it's time, let's file. And so she is, well, first of all, we know that she's not eligible for retirement because she's not old enough, right? She's not 62. We know she's old enough for survivors because she was just getting ready to turn 60, so she knew 60 was the critical age if she was coming into the office. She knew she had all that age reduction to deal with, but her whole point was preserving her own benefits for later because she wanted those delayed retirement credits. And she's like, I don't know, maybe I'll file it, a couple $100 difference at 66, 67, 68 or something. But yeah, definitely your age matters in all of this. Mm-hmm.
Okay. All right, so we'll have to leave it there
Sounds fine.
for today. That concludes our presentation for today. We'll see you at the next seminar. Thank you.
Thank you.